Good morning, good afternoon, good evening, viewers. My name is Dr. Ubong Ekpene. I'm a consultant neurosurgeon working with the University of Uyo Teaching Hospital in Uyo, Ibom State, and also a lecturer with the University of Uyo. I am here to enlighten us on some of the things that affect our brain and spinal cord, some of the conditions that affect our brain and spinal cord. And in a couple of videos, I will be sharing some light on some problems that affect our brains and our spinal cord. And there's a saying that knowledge is power. These series of videos will seek to empower you with knowledge, debunk some misconceptions about problems that affect the brain and spine, and that itself can keep you abreast with what is happening to you, your brain, your spine, and to be forewarned is to be forearmed. So this information that you would have would help you better manage yourself, understand your body, understand your brain, understand your spine, and that can help you. So I'll be throwing light to a lot of things that affect your brain and spine through several videos. So it's going to be a series that will span through several conditions that affect the brain and spine. But for today, we'll start with something very simple, something very common, something that everybody can relate to. If you've not experienced it, it's either you're a baby or you're just very young, but definitely if you've existed in this world for a couple of years, you should experience it. And that is a condition called headache. Yes, headache. Headache. So what is headache? Headache is can be simply defined as pain or discomfort in the head. It may be experienced as a pressure. Some patients will report it as pain, an ache, discomfort, an uncomfortable feeling, an unpleasant experience. You can name it. But all these are descriptions that fit one thing, something that is unwanted in the brain or that affects the head, and that is headache. So headache is a very common symptom, so common that a lot of times we take it for granted. But the aim of this enlightenment will be to let you know that yes, there are headaches that can be wished away or can be taken for granted, but there are also other manifestations of headache that can be a sign or a symptom of something more sinister, something more serious within our brain. And that's why this will seek to help you understand better. So, headache can be broadly grouped into primary headaches and secondary headaches. So primary headaches are those kind of headaches that do not have underlying illnesses, well defined illnesses that can be related to as a cause. While secondary headaches are those kind of headaches that there is an underlying or there are underlying illnesses that may be the cause, which must be treated for those headaches to resolve. So we'll begin with the primary headaches, which are the very common headaches that we experience every day. So what's a primary headaches? So these are headaches, like I've said, do not have underlying illnesses. So you just treat the symptom. Uh, Very common amongst them is the tension headache. So tension headache is usually described by most people as a dull, aching pain or pressure. And sometimes they describe it as a band-like um, tightness around the head. And usually this can be related to stress, could be related to bad posturing during sleep, and several other factors which we'll look into later on. And so there is another kind of headache which a lot of people tend to say a lot, sometimes without even understanding the implications. Migraine, migraine. So some patients will tell you, doctor, I have migraine. Ask, how do you know you have migraine? Well, doctor, that's what they say. I have migraine. So what is migraine headache? Usually it occurs as an intense throbbing kind of pain, which frequently may be associated with nausea and vomiting sometimes. And typically the patient will tell you that it makes, when the headache comes, it makes him sensitive to light, and maybe one-sided. And then the other type of headache is a cluster headache, still the primary type of headache. Cluster headache typically occurs as a sharp, piercing, excruciating pain that may occur on one side of the head. Typically, it occurs as in cycles, or what we call clusters. Patient will tell you that I tend to experience this headache at certain times. It comes, and after a while it goes, and I'm free for some time, and then it returns. Sometimes it could be one-sided as well. These are the types of headaches that one can classify as primary headache, and in which there are not serious underlying causes. Sometimes you can't identify any. So, what are the causes of, okay, secondary headaches typically can be caused by several things that you can pick up as a cause. For instance, somebody who has a sinus infection. Sinus are spaces within the bone in the face that secrete some fluids that help to keep the temperature on your face, and also it helps with clearing things around your nostrils, your eyes, and your mouth. So they occur somewhere here, somewhere there, and they can become full if there's an obstruction or infection. That is why sometimes you have discharge from your nostrils. Those could be manifestations of sinusitis. So when they are obstructed, it can cause severe pain that can be transmitted to the head and as headache, and in which treatment of those sinus infection can cause a resolution of those headaches. Another important cause of headache is conditions like of cause of secondary headache, conditions like trauma to the brain. We're going to devote several videos to that effect because it's a big condition that we manage a lot as brain and spine surgeons. Another cause is brain tumor. That's another kettle of fish which we're going to deal exhaustively in another video. And the other causes which we'll talk of, secondary causes of headache. And those are causes that, or types of headache that you don't just wish away. Those problems must, your causes must be identified and treated for a more permanent solution. For the primary headaches, most times they are caused by life-related uh, uh, issues like stress, could be emotional stress, physical stress, overexertion, dehydration, that's not taking enough water, enough fluid, poor sleep pattern. If you've deprived yourself of sleep, or your posture during sleep was less than adequate, those are all possible causes. Sometimes it could be just related to hormonal changes in the body, particularly in females. During their menstrual cycle, a certain period in their cycle, they experience this kind of headache. So sometimes it could be diet related. That's a new exposure to a certain kind of diet. It could be as a result of alcohol intake. It could be those who take caffeine, a lot of caffeine, and they want to wean themselves off it. They could experience what is called caffeine withdrawal. This can cause headache. So all these types of headache, they really need just behavioral modifications for them to be taken care of, unlike the secondary headache. So what do you do when you experience headache? You first of all have to observe the headache so you can characterize it. Sometimes you may need to keep a headache diary in which you note the frequency of the headache, the severity of the headache, the periods in which it occurs, and you also note whether it comes in clusters or in cycles, and you note whether it is one-sided or it's all over the head. You also watch out for more serious symptoms that would require more attention, or more urgent attention, like having convulsion associated with the headache, having blurred vision, and you can't see clearly as a result, or double vision associated with it, or you experience weakness of one side of the body. These and many more are symptoms that can necessitate you having to see a doctor earlier. And so when you now see a doctor will take a detailed medical examination or take a detailed medical history and examine you thoroughly to determine if there are underlying secondary causes to that headache or of that headache. And then they also will it may be necessary for some investigations to be done, which could just mean an X-ray of the sinuses, a CT scan of your brain, or even an MRI, magnetic resonance imaging. These are all investigations that your doctor may decide to do if he thinks that the headache is serious enough. Sometimes some blood tests may also be required, all in a bid to unravel the cause of the headache. And the treatments can be as trivial as change of behavior, um, resting more, avoiding emotional stress, physical stress, changing your sleep posture, ensuring you have more adequate sleep, hydrating yourself very well. Sometimes dehydration can be a cause. You work in the sun and you don't hydrate yourself well, that itself can cause headache. So just keeping yourself well hydrated may be a prevention or treatment to such primary headaches. So we're not going to talk about the secondary causes of headache because those ones will need to pay greater attention because those are the ones that the neurosurgeons tend to treat, and those are the ones that you shouldn't ignore. So we're going to devote a video for each of them: the brain tumors, the traumatic brain injuries, vascular problems like stroke, bleed in the brain, obstruction to blood flow in the brain, um, several other things that can cause more serious headache. Those are the ones that we'll address in individual videos. But for now, I want to encourage you, um, get to know more about yourself. You can comment, and based on your comments, I can know what more videos to or what's to additional information you need in my subsequent videos. You can you can also share with others so that they can get to know issues that relate to their brain and spinal cord. You can subscribe to this channel so that you can get the videos to others. And also click on the notification if you want to be aware when another video is out so you can watch. Most importantly, stay enlightened, know your brain, know your spinal cord, keep fit, stay blessed. I'll see you in another video. Thank you.